Welcome back to the Roundtable on Environmental Health Sciences, Research, and Medicine. And our session is Bringing Public Health into Urban Revitalization. I'm Richard Jackson. I'm Chair and Professor of Environmental Health Sciences at the University of California, Los Angeles Fielding School of Public Health. Our presenter this afternoon comes from a city that's learned a lot about revitalizing, particularly after a tremendous impact. I'll just say a quick story to the side. So I did the Tisch Fellowship at Roosevelt House last year this time, and I went to New York and I was going to study the results of Superstorm Sandy and how it would be rebuilt and the rest. And I thought that I knew a lot about climate change and health and how people could make themselves resilient, how to build and the rest. I got to New York and realized I knew nothing about what a city has to go through as it really confronts an immense impact such as Superstorm Sandy, $60 billion worth of damage, 250,000 cars alone, vehicles destroyed, and tremendous impacts. But the impacts on people with this 14-foot sea level rise over mean high tide were tremendous. And New York had to think about, and the New York region had to think about rebuilding. Nupur Chowdhury is Senior Project Manager with Rebuild by Design. I'm going to say that name again, Rebuild by Design. She has experience and she has a degree in urban planning from NYU, the Robert Wagner School, and a master's degree in public health from Columbia. New York has really had lots of ways to spend. I think New York City got $40 billion and New Jersey got about 20. You can correct me on that. But I'm sure everybody wanted some of that money to rebuild whatever their own pet project was. And how do you pick where you spend the money and what's going to have the most benefit? So with this introduction, I'd like to ask you to welcome Nupur Chowdhury, please.